On the Health Watch tonight, local researchers responsible for a breakthrough that will help in the fight against aging and Alzheimer's. The night team's David Douglas following the developments for us all day. David, the implications here far-reaching.
Absolutely they are, Eric. This study group is the largest group of healthy, asymptomatic adult children of Alzheimer's patients anywhere. And the finding will likely one day change the way the disease is both diagnosed and treated.
My dad had a pretty good sense of humor, and so that kind of fell away as his memory declined.
Larry MASTALISH watched his father fade away as Alzheimer's disease took hold, and his dad lost his grip on life.
It's difficult when you know what their past had been, what their background had been, and what they were good at, and no longer could function.
He's turned a painful loss into action.
Bed, tree, pencil.
By participating in a long-term study to help detect Alzheimer's earlier.
By the time you diagnose Alzheimer's disease, it's really, really late. It's a devastating disorder to the family, the extended family. It's a very costly disorder.
And now Larry is not just part of a study, but a major discovery. Dr. Mark Sager and Sterling Johnson of the UW School of Medicine and Public Health found more than 200 people in their study with a certain high-risk gene linked to Alzheimer's did far worse in cognitive testing than those without it. Brain scans indicate those people had less gray matter in certain portions of the brain, indicating early neurological changes linked to Alzheimer's.
If we wait to intervene by the time a patient has dementia, the brain may have lost too many neurons already, and treatment may be less effective or ineffective.
Johnson and Sager's findings could change all of that, allowing a simple blood test or MRI to detect the disease, moving up the timeline for treatment, giving life back to Alzheimer's patients with plenty of years left to live.
If the disease is related to genetics, I certainly would want to do whatever I can for my children and grandchildren. I think part of the reason for doing it is just try to assist or help people, in the future to avoid this dreadful disease.
Interestingly, MASTALISH and others will never know if researchers find them to be at increased risk for the disease, and the findings may never help them. They do it for those future generations you heard about.
And it begs the question here, the cost of care for Alzheimer's, huge.
It sure does. It is a massive cost, and there are currently 5 million American adults with Alzheimer's. And if this one day finds another 5 million, the associated costs obviously double pre-existing conditions, possibly interfering with long-term care insurance. Lots of questions that come up as Alzheimer's is widely considered the next big public health crisis in this country, Eric.
All right, David Douglas reporting tonight. Interesting story, David. Thank you very much. A new report details those costs of caring for people with Alzheimer's. From 2010 to 2050, the costs will exceed $20 trillion in today's dollars. Medicare costs alone will increase more than 600% to $627 billion.